you'll see B, C, D, and X. Okay? B means they're never going to tell you every drug is safe during pregnancy. They kind of cover themselves. But a category B is going to be your stuff like Tylenol, Zyrtec, Claritin, Mucinex, things like that. C and D are going to be things that maybe like seizure medications. You have a mom that's pregnant that has to take her seizure medicine or she's going to have a seizure. So there are risks involved, but the benefits outweigh the risk. But a category X means there's documented literature that if you take this and you happen to be pregnant and you don't know it, the baby will have deformities, 100%. So if any of you have taken Accutane or have a child that has taken it, you have to do this My Pledge. Every 30 days when you go back to get the prescription refilled, they go on their device and they pledge to not get pregnant. If they're going to have sex, they're going to take 2 forms of birth control and attest to all that every single month until they're off the medication. Okay? So, but it works really well. And some kids that get no relief from anything else, that's what saves them, is that. You may see females on birth control that are not sexually active just to help with the acne outbreak, so you will see that as well. So the ones that do get Accutane, we recommend oral contraceptives and a second form of birth control, like I said, for extra protection. Accutane causes severe photosensitivity. So make sure that you educate your patients that you're working in a clinic and they prescribe this, that they need to think about times of the year, times of the day that they're outside and getting exposed to the sun, because they will burn a lot easier than they would have off of it. Okay, question about acne? Let you make good sense to you. Okay, so when I run across the condition and there's 2 names for it, I always like to say it not to confuse you, but if you see it on the HESI, they may say atopic dermatitis and you're going to go, oh yeah, that's eczema. It's the same thing, but it can be called 2 different things. So eczema or atopic dermatitis is the same exact condition, but called 2 different things. This is a great picture of like an annular circular lesion on the hand. Know that when you have a child that has eczema, they are pretty much, you can just think that somebody in the family has got pretty significant allergies, and now this child does as well. So family history of allergies. These children may also have asthma. You see our little kids that have asthma and eczema and allergic rhinitis. They're just little allergic little time bombs. So what we find is we've got super sensitive skin, dry skin that causes itching, pruritus, so scratching, which then makes them susceptible to getting secondary infections like impetigo from scratching the lesions. Okay? You've all probably seen maybe a baby or a child that has super duper 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 red cheeks that are like dry, or patches on the arm, and you probably were like, what is that? But that's most likely was eczema. It's worse in the winter months, okay? Again, depending on the family history, sometimes babies will start breaking out with eczema patches, and we find out that they have a milk allergy, so we change them to a soy formula and the rash goes away. So there may be a hidden something going on in their diet that's causing them to have these eczema outbreaks, but it also just might be environmental. Are they using Gain laundry detergent? Super high fragrance, okay? So one of the first things we tell these parents, everything fragrance free, which nobody really likes that, it's boring. But there's method to the madness there. The fragrance is a trigger, and so it's gonna make them itch more and have further outbreaks, okay? So we're gonna take them to fragrance-free products. We're gonna make sure they wash the clothing. If they go to Kohl's and get a brand new sweater, they need to wash those things prior to letting the child wear them for the first time. Get all those extra dyes and everything out of the fabric. We actually recommend less bathing because water actually strips moisture out of the skin. So we tell them reduce the amount of baths, especially during the winter months when you're not sweating profusely. Less bathing. Use a moisturizing soap like Dove Unscented or like Cetaphil or CeraVe. Y'all seen all those products probably. Again, very boring, no scent to them, but are very appropriate for kids with sensitive skin. As soon as they get out of the bathtub, you need to be lubing them up, okay, when their pores are open. If you keep them lubricated, a lot of their exacerbations will go away. So, Lubriderm, Eucerin, Aquaphor, again, sensitive, fragrance-free and sensitive type products as soon as they get out of the bathtub. Years ago, people used to use Crisco. You can believe this. The blue tub, not the butter flavored one, but the regular Crisco in the blue jar. They would use that on the baby's skin. Isn't that crazy? So, for super bad flare-ups, steroids are indicated, but we have to be real careful with steroids because it causes skin thinning over time. So if you tell somebody, hey, use some hydrocortisone 1% on that spot on their arm, they want a thin layer a couple of times a day. Don't put a Band-Aid over it because that will start causing problems over time if you put a big thick layer or put a barrier over it. You can also do Benadryl, Zyrtec, Claritin, antihistamine oral for the itching. We want to keep those fingernails short, okay? So if it's a baby, make sure those nails are short. Maybe put gloves or socks over their hands at night when they sleep. They still find a way to rub their cheeks in the sheets and scratch their face, but do what you can to minimize the scratching. Obviously, we'll talk about impetigo in a minute. So impetigo could result from scratching from eczema. Okay? Questions about what you're going to tell the parents to do, what you're going to remove, anything make need further explanation? Okay. All right. So for the kid that kept scratching, that did not listen to anything you said, now we have it impetigo, honey-colored crust. That's the hallmark lesion over here. Honey-colored crust. The only time a honey-colored crust is not abnormal is when you have a little boy healing from a circumcision. That yellow crust is okay. Other than that, when you see yellow crust, you think impetigo or bacterial infection. Okay? So we've had intact skin, for whatever reason, trauma to the skin, a bug bite, eczema that's been scratched, something started, and now we've got an infected lesion. Okay? This kid over here maybe had a fever blister or something, maybe picked at it, and now it's evolved into impetigo. You may see these around the nose in toddlers. Why do y'all think that's the case?
Put the fingers in the nose.
got a runny nose all the time. We got that skin breakdown.
My daughter just had that like a couple weeks ago.
Yeah, this is time of year for
But
sure.
it was right in the inside of her nose.
Yep. If it's one single lesion, maybe on an arm, yeah, let's do some Bactroban. 3 times a day, 7 to 10 days, and you're good. But when it's like this, or it's real close to the mucous membranes, the mouth, the eyes, the nose, you really need to put them on an oral antibiotic for 10 days to get rid of it. Good antibacterial soap. Remember the 24-hour rule in pediatrics, 24 hours free of diarrhea, free of vomiting, free of fever, 24 hours on antibiotics, they can go back to school or daycare. They're considered non-infectious. If you do have someone that has impetigo in the house, make sure that you take all the towels out of the bathroom, all the washcloths, remove anything that could have come in contact with the lesion so that someone else doesn't get it, because it is contagious. And if you have a bunch of kids in the house with all scratching mosquito bites, it's like wildfire. Okay? So oral antibiotics are indicated when it's more than one lesion, close to the mucous membranes, and they can't go back to school for 24 hours until they've been on the antibiotics. Questions? Piojos. Oh, one word I learned in Spanish very quick. Because I worked in a school-based clinic for so long. We constantly were checking heads, and school-agers are kind of the culprits that pass this around. They like to use each other's combs and brushes and hats and spend the night and play with each other's hair, and they may be playing in a sporting event and they all use the same batting helmet or whatever, so there's lots of reasons why it's highly transmissible. So the nits are the little eggs on the hair shaft. Okay, they haven't hatched yet. I'm looking at everybody's faces. And these are the mature bugs.
Sick.
It is. Prevention is key. I always say the kids that have all that hair gel and hairspray do not get lice. So I tell parents all the time, just put whatever blue, green, they can't attach to the shaft with all that crap on their hair. So, itching of the scalp is usually the sign that the teacher or the parent is going to see the kid, scratching their head, and they're like, okay, gotta check the head. How you can tell it's a nit over like a dandruff flake is if you take your forefinger and your thumb and you try to pull it, and if it tugs, you pull the hair out, and you can't get it off, it's probably a nit, and it's a live nit. The ones that are dead will kind of just slide off the hair shaft pretty easily. A lot of products over the counter, Rid, what's the other one, Nix, still kill the bugs, but in those repeat offenders that keep coming back, we usually just put them on the prescription, prescription shampoos that are out there. Natroba, what's the other one? Splice, S-K-L-I-C-E. It will penetrate the egg as well as the bug, whereas the over-the-counter stuff does not kill the eggs. That's the problem. So 10 days later, those nits hatch, and you got it again. So they have salons set up that do nothing but treat lice.
Oh, I've seen those.
And I've heard it's super expensive. Mm-hmm. How would you like to work in a place like that? All day long, bugs. but it won't kill the nit. But if you get a good lice comb and you sit there and comb and get all those bugs out or nits out, and you smother the bug, you can treat effectively, but it's very timely, like hours, days, get it done. Mayonnaise, Vaseline, people that use tea tree oil, like not to treat, but more of a preventative, don't seem to get lice either. I guess they don't like the smell of it.
Would you like that rose hip or what is it?
Yeah.
That one spray. I just spray my kids' hair down with that stuff. I don't think they like the smell of it either. They have their own shampoo.
That's good.
So gross.
Anything that will keep from, that's the key, prevent getting it. Try whatever. Obviously, if you've got one child that has it, you gotta really check all the children and the adults' hair in the whole house.
If they get the pillows or something, or like the stuffed animals or something.
You gotta do all that. Bag up stuff that can't be washed. Vacuum. Sorry. That's okay. Over here. Yes. Wash in hot, dry in hot, which you can. Bag up for 14 days with, the little sequencing pillows and stuff that you're not supposed to wash. Bag them up for 2 weeks. And again, minimize sharing of things, brushes, combs, hair ties, all the things that, could possibly be the source. Questions on peels? And scabies is very similar to lice, but it is a skin louse, whereas lice is a hair, in the hair. Scabies is in the skin. It's very, very similar in the teaching we give families. So you can see these little burrows or gray lines, usually between the fingers or toes or on the wrists, the ankles on the babies. This is how he looks under the microscope. Pretty scary. We see this in homes that have a lot of people in a very small area. And again, you've got one that has it, everybody in the house is going to get treated. Okay, so you just got to assume everybody has it, even though their symptoms may not be there yet.
You can't see these with the naked eye, or you can?
You can see the rash, but not the actual mite, unless you scrape it and put it under a microscope. How do we treat this? Everybody gets permethrin, or Elamite cream. It's a prescription. They put it on head to toe. All go to bed with the cream on. Has to be on a minimum of 8 hours, no more than 14. Everybody gets up in the morning, strips their bed, takes a shower. Usually it's a one-time dose, but the itching will persist for a while, so it's very important to tell the families. Just because the itching is still going on for 3 or 4 days later, a week later, doesn't mean the treatment wasn't effective. It's just that they have to die. I think it's like the feces of the past that's in the skin that causes the itching, from what I understand. But so you can do Benadryl again, minimize scratching, because we can get impetigo from scratching scabies lesions. So sometimes these kids end up going on oral antibiotics from scratching from this. So just remember that impetigo is a secondary condition from something else first. Questions about scabies? I know y'all have had it for the week. Diaper dermatitis. Obviously, most kids will have this at least once when they're in diapers. So most
Never
of
that
y'all.
bad. Oh man, that's too nothing away. Yeah, sorry.
So the pH in the urine and the feces in contact with the skin causes the skin to break down, and then you have the excoriated areas. Best thing for this is to prevent it. Every time you change the child's diaper, just put some kind of barrier ointment on there, and it really helps form a line of protection between the skin and what's in the diaper.
Let's say, I know triple paste seemed to work the best.
I like triple paste because it has the antifungal, which a lot of kids will get a yeast infection though. So that's what I was going to say with diaper rash is you've got families that, you know, will have the Boudreaux,
Right.
the zinc oxide, the white cream, and they're like, it's not working this time. And sure enough, you look at it and you can tell it's yeast, and you add nystatin and it goes away.
Well, it was like my first one. We tried all that Boudreaux's butt paste and like all that.
I like Dr. Smith's. It was made in San Antonio. I don't know why they took it off the market. It was, we used to put it on the babies in the NICU.
Okay.
But it was just like Boudreaux's, the white high zinc oxide percentage. Key is frequent diaper changes. Okay, clean between diapers with mild soap, water, dry really, really good. Barrier ointment. Use something with the zinc if you know you're going to get a better, quicker resolution. And then just watch for that. When it's yeast, it's going to be Byrongen red, satellite lesions, not responding to the normal diaper cream. So, happens a lot because it's a very wet, dark area.
And my daughter always had that. Like, she would have it like 3-4 times a month. I took her, got the
You know what?
nystatin and stuff.
I will tell people that
I
I
thought she
swear this, it's not going to be on the test, but this is just practical for life. If you take a hair dryer and put it on a cool setting, and every time the skin has to be dry for a moment to start healing, and a lot of people will clean the butt's kind of still damp, put the cream on, and then diaper again. But if you clean it, take the hair dryer, blow the butt dry, plus it feels really good. The babies are like, ah. Then get the skin dry, then put the cream on. It is like you start seeing that you're not just spinning your wheels. Yes.
I was gonna say, it's funny you say that because that's what my first son, he was having that issue, and they said he needs to let his butt air dry. So we just put him on a puppy pad and let him lay there
No, that
for like an hour or two.
Yeah.
They're like,
For
just
sure.
lay him with, they said basically use tummy time to take off the diaper, put him on a pad. And
It works.
Yeah.
Air is your friend for sure. Okay. Wow, that's it. I go into a whole lot more other stuff in the other class, but those are all that we'll talk about, and then we're going to do burns, and then y'all get to go home. Ooh, we're not doing that. Okay. Read that. You know there can be different sources of a burn, right? Electrical, flame burn, steam, I mean, all kind of sources. So just know that it's not from just one source. I'll let y'all read all the stuff like that later. Things to prevent. Babies should not, we can't use sunscreen under 6 months of age, but they do make now these really awesome UVA or UVB suits that you can put babies in now that are going to be out in the sun. I think that is an awesome thing that they've added. Fire safety is taught usually in the elementary or preschool age kids. Stop, drop, and roll. All the things you can do as parents, make sure the hot water heater is not turned up past whatever the degree is. I can't even remember. Be careful with microwaving any food because there can be hot pockets. So just test all that. push everything on the stove back. You see those kids that will grab the coffee cup, you know, those toddlers, and it takes that long. So we do, I know it's kind of cut off here, but the rule of nines is what we use to determine the TBSA, total body surface area that's burned. I'm not going to have any questions on the test that says calculate this baby's TBSA. I'm just letting y'all know that's how, like kids that go to Shriner, they will use that to figure out if it's a 32% TBSA or 5%. Obviously, depending on the size of the baby and where the burns are, the percentage may be higher than what you think it is.
Is it like the rule of sixes or something?
First degree burns, it's basically a sunburn. Epidermal layer only does cause some pain and then itching. Antibiotic ointment may be indicated if it's, you know, peeling or whatever. They're not supposed to peel with the first degree, but, you know, sometimes it happens. Partial thickness, a second degree burn is supposed to be one of the most painful because the nerves are still intact. So any movement, air, even light touch is painful. You will see different colors, not just red with this. You may see blistering. You may see like white patches. So also, you can treat with an antibiotic ointment if you needed to. Second degree burn just kind of shows you an illustration of how deep it is. So when there's blistering present, just assume it's second degree. And this is probably what happened here. She grabbed something and maybe tried to take a sip of something that was hot and then splashed. This looks like intentional submersion. So we gotta always think about that too, depending on the area that was burned, the age of the child, you know, was this an accident or was this intentional? Because we do see that at Shriner a lot. Horrible. So it just pretty much explains what I just said. You may have white patches, blisters. It may have a dry appearance. It's going to be very painful to treat. If you're coming on to seeing this event occur, you're obviously going to extinguish. Cover with a clean cloth. So if you ever are in a position where you are rendering aid to someone that has had a burn, the burn centers actually want them to come clean and dry. They don't want aloe vera and creams and stuff. So cut off the clothing, remove jewelry, find a clean sheet or something and just cover them up and transport them. Deep partial thickness or a third is going to go all the way, not through, but to the muscle. There's a picture of that. And people ask on the top what that slice is, but if you've heard of compartment syndrome, they will go in and make a little incision in some areas just to allow for pressure and swelling and all that to happen so it doesn't stay tight in there. So it kind of allows it to expand and breathe on its own to prevent compartment syndrome. So tough, leathery, dry, maybe black, white, brown, or tan. Full thickness. And that is considered a 4th degree burn, and usually these are, we see these post-mortem.
Say, would you have to amputate that if it was allowed?
Possibly, and that's one thing I am going to talk about. So cartilage does not regenerate itself. So if you've ever seen a child with significant scarring that looks like they've been burned and they have like a piece of their nose gone or an ear. That's because cartilage does not regenerate itself. So depending on the significance of the burn, they will remove parts of the ear, or maybe the entire external ear. You can see like the ear canal, but the ear itself is gone. But yes, fingers, toes, hands, legs. If the limb cannot be salvaged, if it's beyond just skin and sub-Q, that's not grafting, it's not going to fix it. They have to remove the extremity or the digit or whatever it is. You know, electrical burns, there's always an entry and an exit wound, and sometimes the exit wound is worse. Emergency treatment, always stop the burn. ABCs apply with anything. If you ever have a question on any test, NCLEX, HESI, don't forget your ABCs. Do not try to overthink. Do they have an airway? Can they breathe? Do they have circulation? Okay, now we can start worrying about other stuff, like pain, IV fluids, whatever we need to think about. But don't ever lose sight of ABCs in any situation, including this one. If you have a child that has facial burns, just know they've got airway burns as well. They've got upper airway burns. They may have sloughing of the airway. So if you see facial burns, ABCs may be an issue. Okay, call 911. They may be hard to even intubate depending on the significance of the burn because of all that swelling and sloughing of the tissue. So just know that it's not just the face that's burned, it's their airway. We've already talked about clean, dry sheet, transport to the hospital. These are just some what the body is doing. So the body goes through a really major transformation when a burn has occurred, with fluid shifts, glucose. They go into like a hypermetabolic state where they're blowing through glucose. So a lot of things happening at all levels with the burns, not just the cosmetic effect that is being affected, is so many things else. And really, IV fluids is higher priority than even pain relief because they lose so much fluid in a burn. If you've ever been in a burn facility, you'll notice they keep it very warm there because these kids cannot maintain their temperature after that significant burn. So it's a very warm environment. High risk for infection. Remember, skin is our protector. So when the skin integrity has been broken down, we're super susceptible to infection. Strict reverse isolation, fluid replacement I've already talked about. We're going to really watch labs. Strict INO, very, very important because, again, we're going to be on a lot of replacement fluids. We're going to be checking that. They may be on a full regular diet, but also may be supplemented with a DOPOF, like a feeding tube, because they need remember, these kids are still growing. And they're using all their calories now to heal from this traumatic injury. And so they can't eat enough calories. So a lot of times they don't want to eat because they're in pain. So we got to get their calories in some way so that their body can heal from this injury and continue to normal growth and development. Obviously CPS is called when it's questionable what's going on. They might interview both parents, all the caregivers, compare stories. These kids that are significantly burned have surgeries over surgeries for years to come. reconstructive, removing, escharotomies where, they go in and release a scar, to, you know, cause they're getting contractures, they hold their arm like this and they have to go in and, you know, open things up again. They're followed by child psychiatry as well because they've had a traumatic event that changes how their appearance is. And so, it's not just, like I said, a cosmetic thing. All right. Questions on burns or skin? Okay, so next week we have musculoskeletal and neuro, endocrine, HEMOC, and there's a little post like disease, reservoir, talk a little bit about vaccines, childhood immunizations and vaccines, that one will go pretty quick. So 2 more lectures. What I have is I go back to the last HESI that was given in this class, and I kind of tweak a HESI PowerPoint that I have based on the last exam. So y'all have that test 3 Tuesday, and then y'all don't come to school the next day. Then the following Tuesday is y'all's HESI. But y'all can always email me too with questions, you know, if you need me to help you or answer questions or clarify. So let me fix, who else came in? Ebony? Me? Oh, you. I knew there was 2.
But then I did like some glamour.
It's my hair. There's another one
Where? Oh, good for that joke.
Well, they'll look better
That
once
is
I
so good. I'm so glad she. She's made her do something.
There's like a
Let me just, I'm real quick, can I look?
She's very bad.